to talk about is the common question that we get from parents. What is the perfect age, perfect time for my child to start their braces? Well, not going to have a definite answer on that one, a little bit vague. It really depends on a lot of factors. Age of the child, bite problem that we see, and even maturity and willingness to cooperate from the patient. So let's chat a little bit about different scenarios. Screening, age 7. At age 7, we talked a little bit in a different video why age 7 is the ideal time to have a first screening. Certain adult teeth have come in already, molars at the back that grow in around age 6 or so, and front teeth. Now, some kids might be 5, some kids might be 7 or 8 years of age when we're at that point. 7 is just a guideline that is most appropriate and agreed upon to have a first screening. Doesn't mean we're going to do anything at that point. It's just a screening to see, hey, do we need something now? Do we need something in the future? What do we want to plan ahead for? So at that point, we'll give you an idea. In some more severe cases, if there's a crossbite where some top teeth are fitting inside instead of outside, or there's severe crowding, or there's, a tooth stuck that's not growing in, you might have different recommendations. An expander, a few braces to help out, certain scenarios there. Most of the time, most children will be ready at around age 12. And age 12, typically, most of the adult teeth are in, not always, but typically. Now, there's a range. We have seen kids as early as 9 years of age that have all their teeth, even the teeth that we expect to grow in at age 12. And I've seen, of course, 15-year-olds in the office coming in for a screening that they still have 12 baby teeth in there. There's a range, more common, age 12. Now, age 12 is a great age to correct an overbite, overjet type of problem, crowding problem. Flip side, kids that have an underbite, so where that bottom jaw and the bottom teeth are further ahead compared to the top ones, a little bit different scenario. These types of bites we're going to treat at a younger age to try to prevent and correct as much as possible early on. And in other cases, we're going to wait until the growth has stopped, meaning jaw growth. And for boys and girls, there's a little bit of a range, but it tends to be later on in the teenage years. So again, if you're not sure, age 7, screening, just to give an idea, and then plan with Dr. Knoffel when is the right time. Some kids are super excited about braces, we hope they are. When we have someone that's excited about braces, that understands the process, of course they're going to cooperate better, and that's to your advantage. Now for kids that are nervous, that have anxiety, that's okay. Nothing wrong with having a screening and planning out, and even transitioning to braces slowly, starting off with a few braces and adding as we go along to make sure that your child is comfortable, right? For other kids, if they're really, really adamant that they're not keen on braces, then we sometimes see their cooperation decline where they're not brushing and flossing as they should, they're not being careful with their braces, and maybe not wearing elastics. That's a time then maybe we want to delay a little bit just so they have a chance to be more prepared and be more willing and accepting of the braces process and start then. Any questions, concerns you have, of course, about your child's teeth and their bite, don't be shy. Come for a visit, have a chat with Dr. Knoffel so he can talk to you about whatever concerns you might have, and then plan when the best time is for your child. Thanks again. We'll see you next time.